Hi, welcome to my channel. My name is Enorita James. I am a clinical research scientist of over 22 years experience. If this is your first time in my channel, I talk about disease prevention, using natural means, disease prevention using routine laboratory tests, using natural diets, and eating the right kind of food that can prevent degenerative diseases. Today I'm going to be talking about cancer prevention methods. Now, if you don't know what cancer is, I have, two videos on what cancer is and the treatment options that are available in terms of treating it if you've been diagnosed of cancer. The reason I'm doing this video is because I was diagnosed many years back, and I know the fear that comes into your heart once you've been told that you have this monster of a disease called cancer. So I feel I should put it out there and maybe help somebody there, especially if you've been diagnosed, or somebody that you know, or somebody that is a family member that has been diagnosed of cancer. But I'm putting particular emphasis on breast cancer because that was what I was diagnosed of. So in this video, I'm going to be telling you some things you need to do, some food you need to eat as a preventive measure from cancer. Because believe me, if you look at my video where I talked about the treatment options have so much side effects. And I'm speaking from experience. So it is better that whatever you hear in this video, take it to heart. Research about it and start doing it, especially when it comes to your nutrients. God has given us a lot of food that can prevent this. So it's just that we don't create time to do the research and eat it. So I pray that as you listen to this video, you're going to get something out of it and you're going to start doing it. It's for your own good. Because I always say that prevention is far, far better than cure. So let's go straight to the video and let me show you the kind of food that you can start eating now that can actually help you in terms of preventing cancer. The very first cancer prevention method I'm going to be talking about is routine medical tests. A lot of people do not do routine medical tests. People wait until they are sick before they can get to the hospitals and do a test. Stop that. Start doing a routine medical test at least quarterly, once every 4 months. It's important, especially in terms of prevention of cancer, because if cancer is caught early, the treatment can be quite successful. But bear in mind that just doing a blood test is not used on their own to diagnose cancer, but they can really help in terms of giving clues to your doctor or to your physician on what next to do, and the earlier the better. So for men, the best tumor markers that you could ask your physician to help you do is what is called the PSA. PSA stands for prostate specific antigen. Tumor markers are substances that you can find in your bloodstream, and they are normally produced from tumors that are growing in a specific organ in your body. So that's why they are known as markers. So when such a substance is increased in your blood, it simply means that there's something happening in that organ that is not normal. That is why it's important you do your routine test for such tumor markers for men. Another tumor marker is AFP. This is called alpha fetoprotein, and most times for testicular cancer. And CEA, this is termed carcinoembryonic antigen for colon cancer. So As long as you're over 40 as a man, start doing this test. Start doing all these tests. It will save you a lot. For women, CA15-3 is normally produced from lumps in the breast. So if you do a CA15-3 and it is increased, other things may cause it, but it is best for you to know so that maybe other tests can be done to actually find out what is causing this increase. Another one is the CA Casino 125 for ovarian cancer, CEA, as I've mentioned, for colon cancer, and pap smear. Pap smear is normally a little sample collected from your cervix as a woman, and this is normally used as a screening for cervical cancer. All these tests you can do in any standard medical laboratory. So please, start doing your routine medical test. I cannot emphasize this enough. For both males and females, you can also do a full blood count test and an electrophoresis test. It is not important to know what all this means, but once you know the names, request it from your doctor that you want to do this test at least every 4 months. The next preventive method I'm going to be talking about, strictly for the women, you need to learn to do a routine breast check. I'm going to play this video so that you see how you can be doing a routine breast check.
Breast cancer is a type of cancer that you may be able to detect yourself. Breast cancer originates in the mammary glands, so make sure to check the entire mammary gland area. Check your breast once a month, ideally around the end of your period, as your breasts are softer. If you're no longer having periods, choose a day such as the day of your birthday to do the monthly check. First, check the appearance. Observe your breasts while raising and lowering your arms. Look for any changes in breast shape, difference in size between the breasts, puckering, dimpling, and sores. Squeeze each nipple softly and check for bloody discharge. Check the upper part of the breasts that are easier to check in a standing position. Breast cancer tends to develop in the upper outer portion of the breast. About half of breast cancer cases are found here. Soap will help glide your fingers easier. Use these 3 fingers to press breasts. Start from the top. Press and feel. Repeat this process while gradually moving downward. Be sure to use the pads of your fingers rather than squeezing the mammary glands. Next, move to the area under the arm. Feel for any swelling of the lymph nodes. Move your fingers horizontally towards the breast. Do a self-check lying on your back as well. Focus on the lower half of the breasts. It's easier to check this part when the breasts are spread flatly. Use your left hand to check the right breast. Raise your right arm. Press the breast with the 3 fingers of your left hand. First, gradually move the fingers downward, pressing and feeling. Next, gradually move the fingers horizontally from outside to inside, pressing and feeling. Lastly, feel the entire breast in a circular motion. Then repeat these steps on your left breast. Make sure to cover all the area.
Now that we are done with that, I hope you'll be able to be checking your breast routinely. Now, the next way of cancer prevention is beating cancer through diet. From research, it was found that cancer is formed 5 to 10% of cases from genes and 90 to 95% from environmental factors. And of this 90%, this is how it was broken down, the environmental factors that can cause it. Diet takes 30 to 35%. Other factors like obesity, 10 to 20%, infections, 15 to 20%, tobacco, and so on. But you can notice that diet plays a very huge role of cancer. So that means that we can actually eat the right food to starve cancer. It has been found out that certain foods and fruits and vegetables contain naturally occurring angiogenesis inhibitors. Now, if you don't know what angiogenesis is, I have a video that I explained this when I was talking about what cancer is, how it is formed, why the lumps are formed in the body. I will link the video right here. You can go through it to understand what this means. So there are certain foods that can inhibit angiogenesis. These are the kinds of foods. These are dietary sources of naturally occurring anti-angiogenic substances. So you find out that if you can incorporate all these kinds of food into your diet, one way or the other, you will be preventing cancer through preventing angiogenesis. And these are foods that you can find commonly. They are common foods like the green tea. This is so important. Strawberries, apples, pineapples, red onions, red grapes, sardine, tomato, garlic. These are things you need to begin to incorporate into your diet. I actually discovered this website where you can find the kinds of food to eat for cancer prevention, including recipes. So if you have time, maybe after watching the video, you can rush to this website and you will find a lot of details there, especially recipes. There are also certain dietary supplements that may also help reduce the risk of cancer or support the body during cancer therapy. If you want to take supplements, such supplements, always look for dietary supplements that contain whole food, carotenoid, flavonoid, and cruciferous. These are very important substances or compounds that can play a very good preventive role in terms of cancer prevention. This is the supplement I have been taking since 2015 and it's been quite good for me. It contains carotenoids, flavonoids, and cruciferous vegetables, and these are the vegetables that contain those substances. So the reason I take this supplement is because sometimes, because of our busy schedule, you might not be able to be taking all this that contains those important phytosubstances that your body actually needs. I've come to the end of this video, and I hope you've learned one or two things on different ways you can prevent cancer or any other kinds of diseases through routine testing, through the kind of nutrients that you take, and through supplements. And as I always say, prevention is way, way better than cure. Thank you for listening, and see you in my next video.